Hello friends, I am Dr. Anurag Saxena, Head of Department of Neurosurgery at Manipal Hospitals, Dwarka, New Delhi. And today we are going to discuss about a very commonly seen topic, a pituitary adenoma in our neurosurgery OPDs. Pituitary adenoma or a pituitary tumor is basically a tumor which arises from the pituitary gland of the brain. This is called as master gland, which secretes most of the hormones like growth hormone, thyroid hormone, prolactin and your sex hormones into the body, and it is very important for our well-being and growth as well. So whenever a tumor arises from this kind of gland, there can be two possibilities. One, it is a null cell adenoma, which means that this tumor is not arising from the cells which forms hormones. So in those cases, the hormone levels do not change and the pituitary gland starts to increase in size, and this tumor, as it grows, it starts to compress the optic chiasm or optic nerves or the visual nerves. In those cases, whenever the tumor grows to significant size, patients may complain of visual loss, especially at the periphery, and eventually they will come up with a tunnel vision, and that can, if left untreated, can cause permanent visual loss. Those tumors which secrete hormone they come to us with different symptoms. Now it largely depends on what type of hormone it is producing. For example, a growth hormone secreting tumor will present something like an acromegaly. For a prolactinoma may present with hormonal problems like infertility in females or galactorrhea, which means excessive breast secretions in young ladies. There are multiple presentations of this kind of tumors. Whenever it is diagnosed on a MRI scan, or it might be diagnosed by an ophthalmologist seeing the constriction of the field and then refer to us, the first thing come to our mind is to decompress the tumor. It is normally done after complete evaluation and anesthesia fitness. Most of the time the surgery is done through the nose, which means an endoscope is introduced via nose without any scarring or giving a scar to the patient. We reach to the skull base and we remove the tumor and come out of the nose. So there is hardly any, this surgery is usually around 2 to 3 hours of surgery, and it doesn't involve any scar which is visible for the patient. Most of the time we are able to remove the tumor completely. Then the biopsy report shows us the type of the tumor and further treatments are required. Now this entire surgery or this entire management of the patient requires a comprehensive approach or a team approach, which involves a dedicated neurosurgery department, endocrinologist, post-operative physiotherapy, and a lot of other departments are involved in patient care. So most of the patients should be treated in a comprehensive center, which is a state-of-art facility like ours. And most of the time the results of this surgery is really great and wonderful, and patients can go back to their normal life within a week or two of surgery. Thank you.